Compassion. It's a word we often hear in healthcare. Certainly this is where compassion belongs. This is where it's needed most.
The Bon Secours staff regularly receives praise from patients and their families. Notes that arrive here are gratifying, genuine, and often reflect strong religious beliefs.
This is Compassion Renewed. Across the Bon Secours family of hospitals, outpatient offices, and medical practices, that sense of compassion is brought back into focus with the daily huddle.
You were such a comfort to all of us. God's light shines though you as you work each day at one of the hardest jobs I can imagine.
At this huddle early one morning at Richmond Community Hospital, an employee shares a letter received from a family member whose loved one spent her last days among this group of compassionate employees.
It just makes you feel good that you work for a company that's here to help people.
Providing compassionate care for persons who are sick and vulnerable is the foundation of our ministry.
All right, good morning, everybody. Welcome to Huddle.
To achieve that goal, it's important to have a plan, a way to bring out that compassion.
It's not enough just to be able to come in and just take care of somebody on a day-to-day basis. You need to continue to blossom, that care delivery and hit the communities, touch those folks that don't know, what they don't know, touch the children early, so that we can prevent obesity, so that we can prevent, adolescent hypertension, we can prevent, all the other diseases and things just through education and knowledge. And that's what it's truly about, being able to minister, to the people that we live with and that come here to the facility.
Whether it's Tiger Woods or Michael Jordan or Michael Phelps or the ladies gymnast team, gymnastics, I would like to believe that they have a plan. They just don't go out and hope that they're going to win a gold medal. Does that make sense?
Every Bon Secours employee has a credo card and an opportunity to participate in our Back to Basics seminars. The credo card reminds us that we are instruments of compassion, healing, and liberation.
It could be anything. Someone helping someone in the parking lot, or helping someone find out glasses, or arranging hospice for a family because a loved one is dying. And so we base on that.
At Bon Secours, patients don't just come and go.
We have a behavioral health unit, and the staff that work there know our patients in the community, and they often keep an eye out on them. They look to see when perhaps they need to come back in just to have maybe medications readjusted, or if they just need to be reconnected to an outside resource. They'll see them, on the streets, or they make sure that they go to that outside resource to be a support, for them to help provide the care that they may continue to need.
And employees here look out for each other in the most extraordinary ways.
We had an individual that recently lost her husband, didn't have a lot of resources or family, so the hospital pulled together. We have a gentleman that's a pastor here. He delivered the service. We have a number of people that like to sing. We have a choir here in the hospital. They sang at the service for her. We donated money. We donated our PTO time so that she could have off, during her time and still have some type of income coming in. That's the degree of caring that we give, here at Richmond Community.
These uplifting examples of compassion are shared with employees throughout Bon Secours in the daily huddle. Our tradition is uniquely inspired by the Sisters of Bon Secours and the call to be good help to those in need.
They went out door to door, helping and serving the people that were in greatest need, those that had nothing. They had no health care, they had no means of health care. Oftentimes the mother was ill and couldn't take care of the family, and the father had to go out and work. We provide the same degree of compassion.